I just came back home, and what struck me very much, I mean, Yemen was one of the poorest countries of the Middle East before the conflict, but in 2015, when the conflict really escalated, you see that over a period of now almost 3 years, things are getting worse and worse, layer on top of layer. So you see the direct impact of the war. So you see a lot of patients that we receive, a lot of people with bullet wounds and burns or from airstrikes and shelling. Well, I've seen peaks and lower peaks of violence, but fighting every day. So sometimes you see more than 500 wounded a week, and weeks after you see a few and maybe a few tens or 20s. What I've also seen is a lot of secondary impact of the war. So we saw in these 16 months that I was there, I saw the economical situation go worse and worse. People having less and less economical resources. Staff, especially medical healthcare workers, have not been paid for almost 2 years now. And the people that are really suffering are the civilians in the end. So you see that the healthcare system is collapsing, which created the possibility for cholera and diphtheria and different outbreaks to actually spread. So also in 2017, we as MSF responded to these outbreaks. So we mostly focus on war wounded and mother and children because we see those are very vulnerable groups in a conflict like this. Since 2015, we treated more than 74,000 war wounded and delivered more than 44,000 babies. So we started with delivering 200 babies per month, and some facilities we now already see 800 to 1,000 babies a month. You also saw that many more people come to our health centers because the health centers around us have or closed because the staff have been paid or they've been destroyed by the war, or people don't feel safe enough to go there. So I've seen needs going bigger and bigger, MSF needing to do more and more. And at this moment, Yemen is one of the biggest missions of MSF, and sadly that's because the needs are so massive.